Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome to the Stem Cell Healing Institute podcast. We are here with Dr. Sara Figueredo. She is the director of Advanced Stem Cell Therapy. How are you, doctor? How you doing?
I'm very well, Louise. Thank you so much. How are you?
I'm doing great. So we do have an interesting topic today for those ladies and men, also men, who would like to look better. So we're going to talk about stem cells for cosmetic purposes. In this case, doctor, what will be those cosmetic purposes that we can apply the stem cells to?
Yes, that's a really good question. We get that asked a lot. So basically, the stem cell facelift, as the name implies, can be very useful for deep lines and fine lines and wrinkles, as well as sagging. I think sagging is such a huge one, the jowl area, the chin and jawline, as well as the eye area, the texture of the skin, the tone of the skin, pores. It helps refine pores. It just creates this glow. Basically, undoing the damage of time is what we're looking to accomplish, and which have been, from sun exposure, cigarette smoke, alcohol, a diet that's not very with high in processed foods, so on and so forth. These can all have an effect on our skin. So this is basically undoing the damage, and that can replace a surgical facelift.
And it may also help for scars as well.
Yes, absolutely. Pockmarks from bad acne as children, or some kind of scar, whatever damage has occurred physically or an injury, absolutely can help regenerate and fill in those scars.
And how do you apply these stem cells? Do you do it like in the common way through IV, or do you do it locally on the skin?
It's really important that we get the stem cells as close to the site of damage as possible. And so, yes, we apply the stem cells locally, right at the wrinkles or the sagging, at the wherever it needs it. And also, we address the neckline, the jawline, and that's because it's so important that a lot of women look meticulous and immaculate in the face, but then you look down at their neck, and they have turkey neck, or a wrinkled neck, or whatever the case may be. So we want to ensure that they look consistent. So yes, we address that, and we also apply the stem cells intravenously, so they go everywhere the blood flows, including the skin.
So it might be a total rejuvenation as well, right?
That's right, a total body rejuvenation. Absolutely.
Can it also help the cesarean scars as well?
That's a very good question, and yes, we can smooth out and really diminish the appearance of those scars. Absolutely. For the scar to completely disappear, that you'll always, there will always be somewhat of a you'll know that scar was there. You can't avoid that, but we can get it to the point to where it's almost undetectable. Yes.
So we can say that the stem cells may avoid a surgical facelift. Is that correct?
Yes, absolutely. We can avoid a surgical facelift that requires a greater downtime and so much pain. Downtime again, people have to take time off work to recover and recuperate. A lot of swelling and bruising, and this is completely the opposite. Practically no downtime, no cutting, no bruising, no pain. No major swelling, and it's a phenomenal approach. And we want to mention that when we do apply these stem cells locally, for a facelift, we apply them with a matrix, usually hyaluronic acid, as well as other components to allow the stem cells to stay intact and in place. In order for we get a two-pronged effect. We get immediate suppleness and immediate volume with the matrix. But then we have the long-term effects of the actual stem cells that are regenerating the tissues, regenerating collagen, elastin, refining the pores, just creating that glow, increasing angiogenesis, increasing blood flow and circulation to the skin, and doing all of these things over time. So we have the long-term effect and permanent effect of the stem cells, as well as this immediate suppleness and volume with the matrix. So we get a really nice two-pronged effect.
And the stem cells that you use for this type of treatments, are there any specific ones, or do you use only one type of stem cells?
That is a good question. So we always use adult mesenchymal stem cells, and that can be in the form of a combination of possibly a combination, or we may do it in either bone marrow, adipose derived, umbilical cord, and or endometrial. And so it depends on what we're trying to accomplish with different patients. It's very personalized. So we can use one or the other or a combination.
Doctor, I see something about plant stem cells. Do you use those stem cells?
That's a super question, Louise. We don't use them inside the patient per se as part of their stem cell treatment. However, we do at our lab, we do make a proprietary cream and natural antioxidant, preservative free, as organic as possible. We make creams and serums and a whole line of facial care products that we do utilize plant stem cells, as well as other peptides, and that really work in conjunction with the stem cells, or even without stem cell treatment. And so yes, we do employ stem cells in our products as well.
Well, now I know why you look so young, doctor.
Thank you so much.
Now I know your secret. So, in this cosmetic treatment, what would you include besides the stem cell treatments, doctor?
Mhm. Yes, good. As I mentioned in some past podcasts, and it bears repeating because it's really important. We want to address lifestyle and nutrition. We want to address, and by that I mean, okay, smoker, non-smoker, drinks. How much alcohol do they drink? What supplements do you use? Sun protection. So many. How is the diet? How is the stress? How do you sleep? All these things are so important. So we want to ensure that we're not just injecting you with stuff and okay, good luck and goodbye, hope for the best. No, we want to ensure that these are long lasting, real results. And sometimes we do have to change some aspects of our life if we care to have these long lasting effects. So that means maybe adding key supplements, using sunblock or sunscreen if you don't already do that, perhaps adding a few key sustainable changes to your diet, figuring out, getting to the root cause of any sleep issues. There's so many things. And we do all these screenings. We do this whole workup, right, to a pre-treatment protocol. And then once the patient gets to Guatemala, we have a whole comprehensive treatment package that is included in the stem cell treatment. It's not an option because we want the best possible results. So that involves a detox program with a nutritional IV and suppositories and B vitamin shots. It includes exercise with oxygen therapy, as well as hyperbaric, depending on the patient's limitations. It includes growth hormone therapy, and it also includes stem cell enhancement formula, proprietary personalized blend of herbs and minerals for the patient. And of course, we never ever neglect a patient's psychological and emotional well-being, which is so important. As I've said in the past, our well-being is not only our physical body. It includes also our psychological, mental, emotional well-being. So we address that as well because, we have had some patients that are either, they come in and they're so sick and frail, or they have this, deformity that they have lived with and have dealt with psychologically and emotionally for so long that they need to get out of that funk, for lack of a better word. And so we address these things, with certain key exercises and, emotional and psychological exercises that really help on that end. So that's pretty much our whole treatment in a nutshell.
Thank you, doctor. And it's very interesting everything that you do here at the Stem Cell Healing Institute, all the treatments that you do. And I was wondering if there is any protocol before the patient arrives to get any cosmetic treatment.
Mm-hmm. Yeah, so it's the typical protocol that we have all of many of our patients do. And after we do that thorough screening, which we do for every patient, we look at blood work, we get a good history, and any other reports or exams that we need to have in place before they come. We will do a thorough workup, and then we will give them recommendations and guidelines to prepare themselves, their body, for the stem cell treatment. Absolutely, that's really important for us.
All right. If you want to check what we do at the Stem Cell Healing Institute, don't forget to visit our website, which is stemcellhealinginstitute.com. And if you have any questions for Dr. Figueredo, you may send an email to info@stemcellhealinginstitute.com. Doctor, is there anything else you would like to add to this cosmetic podcast?
Nope, I think we've covered a lot, Louise. And then, as you mentioned, any further questions and specific personalized questions and comments, they can direct them to our email.
Thank you, doctor. And if you're looking for skin rejuvenation, stem cells may help. And I will see you next week, doctor.
Yes, thank you so much, Louise. I look forward to it. You have a good one.
You too. You take care.
Bye-bye.
If you want to contact us at the Stem Cell Healing Institute or Dr. Sarah Figueredo, you may do it by calling us. In North America, you may dial +1-209-690-7836. Also, if you want to write us by WhatsApp, you may add +502-4220-7297. Please send us an email at info@stemcellhealinginstitute.com. And don't forget to visit our website, stemcellhealinginstitute.com. Also, if you like to recommend our treatments, you may find us on Facebook at Stem Cell Healing Institute. Please follow us on Instagram at StemCellHI. If you want to recommend this podcast, please refer to anchor.fm/stemcellhealing. Also, you may find us with that very same name on Spotify. If you want to watch our videos, please go to Dr. Sarah Figueredo. That is on YouTube. Thank you.